By now, we know the familiar warning signs of COVID-19, fever, cough, shortness, but we also know that the virus causes literally dozens of symptoms. Some are simply strange, some are strange but common enough that you'd think they'd be on the CDC's official list of symptoms, but they're not. This list does not include all possible symptoms, says the agency. Here are 5 COVID symptoms you may not have heard about but should definitely be on the lookout for. Read on. And to ensure your health and the health of others, don't miss these sure signs you've already had coronavirus. 1. You may experience hair loss. Shutterstock. A sizable number of COVID-19 patients have been dismayed to discover thinning hair in the days or weeks since their initial diagnosis. Actress Liza Milano notably shared her coronavirus-related hair loss on social media. A new study of nearly 48,000 COVID-19 patients found that 25% of them experienced hair. Experts say this is called telogen effluvium, a temporary all-over-the-head shedding that's caused by a shock to the system, such as fever or illness. 2. You may have skin problems. Shutterstock. Also not on the CDC's list of COVID symptoms but very common. About 20% of people with COVID-19 report skin changes, including rashes. This is where we're obliged to mention the recently much publicized COVID toes. Rashes are painful patches on the toes which can last for months in some people. 3. You may have eye problems. Eyestock. A new study published in BMJ Open Ophthalmology found that nearly a third of COVID-19 patients reported, and that number may be even higher, since people tend to underreport symptoms they don't consider. These issues can include conjunctivitis, pink eye, sore eyes, itchy eyes, or photophobia. Sensitivity. Researchers say COVID may cause eye problems because the virus might enter the body. 4. You may have ear problems. Eyestock. Coronavirus can attack the inner ear, causing dizziness, vertigo, fainting, tinnitus, or ringing in the ears, and even hear. Studies have found that 1 in 10 COVID patients report tinnitus or reduced hearing, often as a late onset. 5. You may have testicular swelling. Shutterstock. According to a study published in the American Journal of Emergency Medicine, reported that a 37-year-old man in San Antonio, Texas, developed testicular pain and swelling 3 days after being diagnosed with coronavirus. The researchers wrote that several genitourinary complications have been reported with COVID-19, including blood clotting issues that can cause priapism, a prolonged pain. 6. How to survive this pandemic. Eyestock is for yourself. Do everything you can to prevent getting and spreading COVID-19 in the first place. Wear a face mask, get tested if you think you have coronavirus, avoid crowds and bars and house parties, practice social distancing, only run essential errands, wash your hands regularly, disinfect frequently touched surfaces, and to get through this pandemic at your healthiest, don't miss these 35 places you're most likely to catch